How AI detects cancer. Revolutionizing early diagnosis and treatment. Cancer remains one of the most challenging diseases in modern medicine, often requiring early detection for the best chances of successful treatment. Artificial intelligence (AI) is playing a transformative role in detecting cancer with greater accuracy, speed, and efficiency than traditional methods. By analyzing vast amounts of medical data, AI algorithms help identify cancerous patterns in imaging, genetic information, and patient records. This article explores how AI detects cancer, its applications, benefits, challenges, and future prospects. The role of AI in cancer detection. AI is reshaping oncology by providing doctors with powerful tools to detect cancer at earlier stages. By leveraging machine learning, deep learning, and computer vision, AI can process and interpret medical images, analyze pathology reports, and predict cancer risks based on genetic data. 1. AI in medical imaging for cancer detection. Medical imaging plays a crucial role in diagnosing cancer. AI-powered algorithms enhance the detection of tumors in imaging techniques such as mammograms, CT scans, MRIs, and PET scans. A. Breast cancer detection. AI is widely used in mammography to detect breast cancer at an early stage. Deep learning models analyze mammogram images and identify suspicious lesions, sometimes detecting abnormalities that human radiologists might miss. Companies like Google's DeepMind and IBM Watson Health have developed AI systems that outperform radiologists in identifying breast cancer in early screenings. B. Lung cancer screening. Lung cancer is often diagnosed at an advanced stage, making early detection critical. AI-powered systems analyze chest X-rays and CT scans to detect lung nodules, improving diagnostic accuracy. For instance, Google's AI models have demonstrated the ability to detect lung cancer with high sensitivity, reducing false positives and negatives. C. Skin cancer identification. Dermatology has significantly benefited from AI in detecting melanoma and other skin cancers. AI algorithms analyze images of skin lesions and classify them based on malignancy risk. AI-powered mobile apps allow individuals to self-monitor suspicious moles and seek medical attention if necessary. D. Prostate and colorectal cancer. AI assists in detecting prostate and colorectal cancer through MRI and colonoscopy images. AI models highlight areas of concern, helping doctors focus on potential malignancies while reducing unnecessary biopsies. 2. AI in pathology and histopathology. Pathologists play a key role in cancer diagnosis by examining biopsy samples. AI-powered systems analyze histopathological slides to detect cancer cells with high accuracy. A. Digital pathology with AI. Traditional pathology relies on manual examination of tissue slides under a microscope. AI digitizes this process by scanning slides and identifying cancerous cells through pattern recognition. AI enhances workflow efficiency by prioritizing high-risk cases for review. B. AI in liquid biopsy analysis. Liquid biopsy is an emerging field where AI helps detect cancer through blood tests by analyzing circulating tumor DNA, ctDNA. AI models identify mutations and biomarkers associated with different cancer types, providing a non-invasive diagnostic alternative. 3. AI in genomics and personalized cancer risk prediction. Genetic mutations often play a crucial role in cancer development. AI analyzes genomic data to predict an individual's cancer risk and tailor personalized treatment plans. A. AI in hereditary cancer prediction. AI identifies genetic markers associated with hereditary cancers such as BRCA1 and BRCA2 mutations in breast and ovarian cancer. By analyzing family history and genetic profiles, AI helps determine an individual's predisposition to cancer. B. AI in tumor genetic profiling. AI-driven tools examine tumor DNA to identify genetic mutations that drive cancer progression. This information allows oncologists to select targeted therapies, improving treatment effectiveness and reducing side effects. 4. AI-powered cancer risk assessment and predictive analytics. AI helps predict cancer risk based on lifestyle, medical history, and demographic data. A. Predictive analytics in cancer prevention. AI models analyze patient data to identify risk factors such as smoking, diet, and exposure to carcinogens. Predictive analytics enable healthcare professionals to recommend preventive measures and lifestyle changes. B. AI in monitoring high-risk patients. For individuals at high risk of cancer, AI-powered monitoring systems track changes in health conditions over time, providing alerts for potential concerns before symptoms appear. Benefits of AI in cancer detection. 1. Early and accurate diagnosis. AI improves early detection rates, increasing the chances of successful treatment. AI-powered tools detect subtle cancerous changes in medical images that might be overlooked by human radiologists. 2. Reduced false positives and false negatives. Traditional cancer screenings often lead to false positives, causing unnecessary anxiety and biopsies. AI improves specificity and sensitivity, reducing the number of incorrect diagnoses. 3. Faster diagnosis and workflow efficiency. AI automates the analysis of medical images and pathology slides, significantly reducing diagnosis time. This enables doctors to focus more on patient care and treatment planning. 4. Personalized treatment plans. AI-driven genetic profiling allows for personalized treatment approaches, ensuring patients receive the most effective therapies based on their tumor characteristics. 5. Accessibility to cancer detection. AI-powered diagnostic tools improve access to cancer detection in remote and underserved areas. Mobile applications and AI-driven telemedicine platforms allow patients to get screened without needing advanced hospital facilities. Challenges and limitations of AI in cancer detection. 1. Data privacy and security. AI relies on vast amounts of patient data, raising concerns about privacy and security. Ensuring compliance with healthcare regulations such as HIPAA and GDPR is essential to protect sensitive medical information. 2. Algorithm bias and fairness. AI models can inherit biases from training datasets, potentially leading to disparities in cancer detection across different populations. Ensuring diverse and representative datasets is crucial for fair AI implementation. 3. Integration with existing healthcare systems. Adopting AI in hospitals requires significant investment in infrastructure and training. Many healthcare institutions face challenges in integrating AI with traditional diagnostic methods. 4. Need for human oversight. While AI enhances cancer detection, human oversight is essential to validate AI-generated results and make final clinical decisions. AI should be used as a support tool rather than a replacement for medical professionals. The future of AI in cancer detection. The future of AI in cancer detection is promising, with continuous advancements expected to further improve accuracy and accessibility. 1. AI in multi-omics analysis. AI will integrate data from genomics, proteomics, and metabolomics to provide a holistic view of cancer biology, leading to more precise diagnostics and treatments. 2. AI in real-time cancer detection. AI-powered devices capable of detecting cancer in real time during surgeries will help surgeons remove tumors with greater precision, reducing the risk of recurrence. 3. AI and liquid biopsy expansion. AI will enhance liquid biopsy technologies, making non-invasive cancer detection more widespread and affordable. 4. AI in cancer drug development. AI-driven drug discovery will accelerate the development of targeted therapies and immunotherapies, improving cancer treatment outcomes. Conclusion. AI is revolutionizing cancer detection by improving accuracy, efficiency, and early diagnosis. From analyzing medical images and pathology slides to predicting genetic risks and personalizing treatment, AI is transforming oncology. While challenges such as data privacy, bias, and integration remain, continued advancements in AI will make cancer detection more accessible and effective. As AI technology evolves, its role in cancer detection will become even more essential, saving lives and enhancing the quality of healthcare worldwide.